started. Welcome to our talk on chronic fatigue, ME, fibromyalgia and post-viral syndrome.
Yes, I'm super excited about this one. Basically, I get quite this work always fills me with so much joy, because if I had been told this, I said this at the HRT one, or the hormone one, to be fair, because my journey has been with chronic fatigue and hormones. And if somebody had told me 19 years ago, has someone had been able to give me this information, if somebody doing the training that you're doing had been able to give me this information, then I would have had a very, very different 18 years. And so I get incredibly excited that we now have so much research that we can put out and help so many more thousands of people not have to struggle the way that I struggled.
So this is a classroom that we do for our diplomas, and so we have our students joining us, but we also have some drop-ins. So if you are new to us, we are the College of Functional Wellness. We have been doing kinesiology, wellness, nutrition and emotional coaching for about 10 or 15 years now. And our work is based on research, our clinical experience and our own journeys of our own ill health. So the work that we're going to talk you through, we always talk about the triangle of hormonal health and how it plays into these different subjects, and we look at it from different lenses. So we are going to be looking at how chronic fatigue, ME, these fatigue disorders, how blood sugars play a role, how stress, hormones, digestion, immune, and looking at, there is, like Claire said, there is some amazing research coming out now, and it is an exciting time to be working in health. There's, particularly with this subject, people who have had these conditions have often been told that it's in their heads, and we are now in a place where we are really starting to understand the nervous system, the endocrine system, the immune system, the digestive system that these conditions sit in. And that's great, because now we can start to really do something about it.
We really can. And I get particularly excited about this because the medical model has been very much entrenched in its position around fatigue disorders for the past 30 years, since, you know, ME was given the name yuppie flu, and it hasn't really changed its perspective. And obviously we're now seeing a huge amount of, I mean, you know, the post-viral fatigue, or aka long COVID, is now in the news on a very, very regular basis. And I know many people who are experiencing long COVID and the medical model, who have been so entrenched in a position that this thing isn't really real. And if we do give you a diagnosis of ME, fibromyalgia or chronic fatigue, soz about that, you just carry on. There's nothing we can do. Are now scrabbling to try and give people an approach, but from the people I know who are really at the coalface dealing with these approaches, they are still very much based in physiotherapy. They're very much based in the psychology of just do your best. Then they're really not established in this science. And so it's the functional nutritional world that have been pioneering this work for the past 20 odd years. And, you know, now we are getting to the point where the medical model, some of the people, the medical practitioners, are aware of this work, but it is not yet been taken on as a standard position in the medical model. And so for me, the reason I get so excited about this is the time, this is one of the main subjects where the alternative or the complementary health world, or as I like to call us, the frontline coaches, can absolutely come together with the NHS, with the medical model, because the medical model are really scrabbling around. And so this is a place where we can absolutely root ourselves in research, science, credibility, and an approach that actually works. And I get really excited about that future for integrative medicine.
So looking at what these disorders are, the WHO classifies them as a disease of the nervous system, but it is very much a multi-system disorder. We see it sitting in, like I said, the endocrine system, in the digestive system, in the immune system. And there are proposals within the WHO that want it positioned in this infectious or parasitic disease. And we're going to talk about how these conditions can often be as a result of post-viral. So we're going to look more in detail into that. There is a lot of clinical overlap with chronic fatigue, ME, and fibromyalgia, and post-viral. Actually, there are slight differences. Fibromyalgia is diagnosed if there is widespread muscle pain with the exhaustion, but all of them are with this chronic fatigue, chronic exhaustion that is life-affecting. The diagnoses are based on whether someone has key symptoms for 6 weeks in adults, 4 weeks in children, or 12 weeks after a viral infection that has no other diagnosis. Symptoms, it does affect women more than men. And we're going to look at this from an autoimmune perspective and an IBS perspective as well, because autoimmune conditions have the same impact on women compared with men. And it's a fascinating piece of research to explore. Is this more of a hormone issue that we are looking at, which is absolutely our specialty area? And it does tend to develop between the ages of 20 and 40. So the symptoms are muscle pain, exhaustion, difficulty sleeping, cognitive difficulty, flu symptoms, headaches, irregular heartbeat, sore throats, allergies, intolerances. I mean, you can read the list, it goes on and on and on. One of the exciting things that happened in 2021 is that the guidelines, is that the WHO, excuse me, my what does that say underneath my
the NICE guidelines?
There it is, NICE guidelines.
Oh, have you got all
Zoom is in
those
the way. And they've started to categorize this mild, moderate, severe, and very severe. And this was really welcomed by the ME community, because it was another sign that the big organizations, big health organizations, were starting to take these conditions seriously. So the NHS approach is, like Claire was saying earlier, tends to be more psychology based. So if you go to the NHS and they have no explanation for why you've got these symptoms, then you will possibly be recommended CBT. And the number of different ME Society websites that I did research on for this presentation, there's a real backlash on this, that CBT doesn't actually help people with chronic fatigue and ME and fibromyalgia. The graded exercise therapy has been really, really criticised.
Really slammed. Yeah.
And we will go into detail of why that is, because the graded exercise therapy is just increasing your exercise. And when you've got chronic fatigue or ME or one of these conditions, there is no way that increasing your exercise is going to help. And we will look at that from the lens of hormones in the nervous system. They look at things like energy management with exercise planning. There's a very strong recommendation within this traditional approach that a lot of rest, a lot of sleep, resting all the time is not recommended. The difficulty with that is that many people who suffer with these conditions actually don't have a choice when it means getting out of bed or being able to move. So there can be a real sort of clash that happens with what the NHS believe is best and actually what the patient is trying to communicate about how life affecting these symptoms can be. There's a lot of frustration for clients who are experiencing this.
Yeah, and I just want to say that all of this might be offered to you if you're taken seriously, if you've actually seen the same doctor or enough doctors for this to come up on your records, that you might be offered this, but only if you've actually got a diagnosis, only if you've been taken seriously, only if you've made enough noise, or only if you've become such a pain that they just want to give you something because they don't know what to do. So this is where the main frustration in a lot of the charities, the fatigue disorder charities comes from, is again, it's another one of the conditions or or group of conditions where it's just a case of, well, there is nothing wrong here. There's nothing I can see. And that's a really important point that we're going to come to. There's nothing I can see on any blood work. There's nothing wrong with you, go away. And so, but you get that repeatedly, then actually the first port of call tends to be the antidepressants, because clearly it's just depression, not there is something very wrong in your body that I just can't see with any diagnostic tools.
I think this has been actually one of the gifts of the COVID pandemic, because there has been such a long COVID explosion that is taken seriously. And the fatigue disorder communities have been saying, well, this is what we've been talking about for years. So I think that's a real positive thing that's come out of the pandemic. So yeah, painkillers, antidepressants, sleep prescriptions. You'll find clients who are often on sleep meds because insomnia and sleep problems is a big symptom that is just really, really difficult to deal with. Now, when you look at the NHS, they don't recommend diet, supplements, complementary medicine, which is a shame, because there's a real gap for us to work together. It's something that we really advocate, that there is a place for the NHS, there is a place for what we offer as well. And the ME Association, when I did the research into what their recommendations were, the lightning process is something that a lot of fatigue disorder patients consider, but it is not something that is recommended. I know it's something that you've tried in the past, Claire.
It's basically a form of NLP, CBT kind of approach. And one thing I would say about things like CBT or something like the lightning process, or any of, you know, the EFTs, NLPs, any of those things, having done all of them and trained in most of them, anything that keeps you in a positive mindset is beneficial. Because my overriding experience with having a fatigue disorder is lack of hope. It's absolute, just this hopelessness of, once you realize that this thing isn't going to just go away, it's then, I can't live my life like this. And then it is this constant trying to find hope that one day I will just even be able to function. For some people, that means not being in a room that is dark for 5 years. I mean, we're talking about absolute despair and hopelessness. So I think that's where some of these therapies have been really beneficial for people, because it is absolutely about giving them hope, but it's not fixing what is going on in the body.
And this is what we would recommend to our coaches who are in the classroom, is that bearing in mind when you are working with a client who has these conditions, coaching them around the hope perspective. Because what we do see is that people who have these fatigue disorders will go to the NHS first. They will go through all of this. If they are one of those that keep on badgering the doctors, then they'll go through all of this. And they often come to us as a last resort. I've tried everything, nothing has worked. Can you help? And so and yes, we can, we absolutely can. And we are going to talk you through the process that we take our clients through when they present with these kinds of symptoms. But it is worth bearing in mind how you coach. That hopelessness can be absolutely something that needs working with. So when we have a client who comes with fatigue disorder, then one of the things that I very much recommend is that make sure that they have gone through all of the NHS tests that are available, because some people don't know that these tests are available.
That the only caveat to that is if their GP will do them.
Yes, but if you keep asking, then you are entitled to them. Because the reason that we recommend this, if there is something that is going on with your thyroid function, the NHS tests are slightly limited. They don't do a full panel. They just look at TSH and T4, your thyroid hormone T4. But it is, if your thyroid isn't functioning effectively, then you are going to have fatigue issues. So it is good. It's the same with vitamin B12, or being low in folate, or being low in vitamin D, or being low in...
I don't know if that was Laura freezing or me.
It could be me. Is that okay? Am I back? We're back.
You're mute.
Technology, which I love and hate in equal measure.
Yeah.
Okay.
We can.
Okay.
Yeah, great, thank you.
Yeah.
Yep. I was going to carry on, but the PowerPoint went.
Oh, I was going to say, keep going, keep going.
Keep going, no PowerPoint. Anyway, carry on.
So if any of these things are imbalanced, if there's anything off it in vitamin D or B12, or if there's your thyroid function or blood glucose, or these can present as fatigue symptoms. So we want to rule out all of this to make sure that there are no quick fixes that we can put in to help with fatigue symptoms. So we do, and checking for autoimmune conditions as well. We will cover autoimmunity a bit later. Okay, I'm still here.
You're still there. Okay, so this is really super interesting, fairly new research. So research on the CDC, the US government website, by Kaiser I can never say that, Permanente, has actually they've done a huge amount of research into the fatigue disorders, and they have established there is a fatigue disorder personality type. And as much as I would hate to admit it, I ticked every single box. So this was something that I'd started. I love finding this out because I'd started to see quite a lot of this panning out in clinic. Most people that I'd ever worked with that had a fatigue disorder were this A-type personality. So we've got workaholics here, but even if they're not workaholics, it's like a massive lust for life. Everybody I know who had been experiencing a fatigue disorder had been a really big achiever, concert pianist, or a ballerina, but to the top of their profession. It was the big personalities and grabbing life by the horns. They have very high expectations of themselves and of others. So it's quite common for them to tip into that perfectionism, which of course is quite a critical place to be. They're predominantly in their heads. So there's a lot going on up here. This was a really big key part of the research. They have been exposed to adverse experiences in childhood, and that adverse experience leads to a dysregulation in a gene called the 5-HTT-LPR gene. Now, that gene, it was discovered that that's actually then what can go on to, it's like a precursor. It doesn't mean that you are going to have a fatigue disorder just because you have an adverse experience in childhood, but it means with the right situation, the right circumstances, we're now creating the environment for one of the fatigue disorders. So 4 adverse reactions in childhood can lead to being 6 times more likely to develop a fatigue disorder. They often feel like the odd one out or are a loner and struggle with friendships. That's a very, very common one, just feeling a bit like a misfit. And they're very highly sensitive to a lot of things. Sensitive nubbin, that's how I like to define myself. The environment, so heat and cold. A lot of people I talk to, they can't do sunbathing, they don't like the cold. Energetically, they sense things, they're the feelers, they're sort of very empathic. Emotionally, they're very often easily triggered, can find emotions hard to handle. I like to describe it as feeling like you're drowning in the emotion, like the waves crashing on you, rather than being able to surf it. So find it very hard to compartmentalize, that kind of thing. And physically, they don't like rough clothing, can't tolerate pain very well, and don't have much endurance, which I find utterly perplexing then, because actually we end up with, can end up with this fatigue disorder where just getting through the day, being out of bed is like an endurance marathon. And also obviously with the fibromyalgia are having to tolerate pain all day, every day, and it's on another level. So these are all precursors that would be the kind of the sign. I think, if I think back to my mum used to say, oh, you were a very sensitive child. She's very sensitive. lots of things like food intolerances, like anybody who's going down, they can't bear strong smells, don't like too much loud noise. These are often the precursors, this sensitivity.
And it is worth for our coaches who are listening, our students, to be able to ask someone these questions and to share this research. It can feel really reassuring for your clients to know that this kind of research is coming through, and it can be some of those aha moments of, okay, so this set the scene for what was to come. So, and it can also help you with the coaching piece of working with that A-type personality, the hard workers, the high achievers, the perfectionism. It's an interesting place to explore.
Well, it is, and because we tend to come at it from the perspective of that perfectionism is very often a trauma response to being perfect, to that's how I'm going to receive love, it's how I'm going to fit in. I didn't feel like I could fit in, for example, if I felt like the loner. If people resonate with that, then I will bend myself, contort myself to fit in, and then that's a high amount of stress on the body. It's a really, whilst we are going to say that in no way do we believe a fatigue disorder is all in the mind, there is very definitely physiology that is going on here and can be supported. The opportunity for coaching in fatigue disorders is absolutely astronomical, because one of the key things that we're always talking about in all of our work is not trying to get away from an issue, but learning how to be in a place of acceptance, which would have made me want to like hit my head against a brick wall when someone said that to me at the beginning. Like, what do you mean I had to accept this? It's not about accepting feeling rubbish, like, because I still got that high expectation of my standard of my life. So, you know, I work really hard to feel well all the time. But that learning how to be in acceptance, how to not be in perfectionism, these are beautiful ways to be able to coach people with these disorders. And we're going to talk a little bit more about that later.
I love this. We have seen this time and time and time again. And this it's like a map, a pathway of what can often happen, the environment that leads to a diagnosis. And that perfect storm that clients often find themselves in is poor diet, and we will go into what that looks like in a little bit more detail later, but we're looking at high sugar, high junk food, processed foods, high carbohydrates, low nutrition, fast food, low protein, maybe dehydration, high stress. So that can come from what Claire has just talked about previously, that perfectionism, that constantly trying to push oneself, or being in a stressful relationship, or being in a stressful home environment, or a stressful work environment. So there's the cortisol adrenaline picture. There's the hormone imbalance. So that can be taking the pill, that can be high estrogen from having a lot of toxic chemicals, that can be the high stress can cause a hormone imbalance, that can be having periods all the time, that can be not having periods. But from a male perspective, that can also be low testosterone. Yeah. Impaired digestion. Digestion is huge in fatigue disorders, huge, and we'll cover it a bit more later. But this not being able to digest, so maybe they've had a gut infection or food poisoning or repeated antibiotics.
And it's very, 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 very common that you hear people who have a fatigue or develop a fatigue disorder. It is very common that they would say they had sensitive guts throughout their whole life. They had IBS, or they were just sensitive to food. They easily got, you know, a funny stressy tummy. There will be, it won't come out the blue, there will be a gut history prior to the trigger event.
Toxic overload can be a number of different things. It can be living in a damp environment that has mold. It can be smoking. It can be toxic chemicals. It can be heavy metals. It can be, I'm trying to think of all the different toxins that there are that we get
loads. Loads of pollution, like
Yeah.
living very much in the city, not getting enough fresh air.
Yeah, yeah. And then we've also got the medication piece. This could be maybe a lot of medication when they're younger, maybe a lot of antibiotic use, maybe some other sort of, there's an antidepressant picture, or there is the pill, but there tends to be, as there can be, a medication picture that happens. So what we have is this body that is under a lot of stress, and then we have a trigger event. And this is what we see with something like long COVID, with a post-viral fatigue, is that the trigger event can be a viral infection like COVID, Epstein-Barr virus, Lyme disease. It can be a bacterial infection like meningitis, maybe surgery, injury, trauma, a big hormonal change. So that could be hitting perimenopause, that could be pregnancy, it could be child giving birth, or immunization. So there's a trigger event that happens on top of a very stressed body.
And I know we've mentioned COVID-19, but I want to actually say that most of the people that I know who have got post-viral, it's from what they would say was just a common or garden flu. They had flu, they never felt better again. So Epstein-Barr is well documented, Lyme disease, post-viral is well documented, obviously COVID-19, well documented, but it's the people who just had a bit of average flu, not even I was in bed for 2 weeks kind of flu, where that is enough to trigger their body into this experience.
And so often the trigger event can be the thing that is blamed. So
Yes.
COVID is responsible for this long COVID. However, whenever we're working with a client in the clinic, we look at the picture of health that walked into that trigger event and how long that picture of health has been going on. So I know from my experience, from my own health experience, I had this history for many, many years. I had it through my teens and through my 20s. And then there was a trigger event. It was surgery that then triggered the autoimmune condition. That was my experience. And I could have blamed the surgery that had triggered that. And when I went to the doctors and said, this has happened after I've had this surgery, they said, that's very common. But actually looking at the poor diet, the high stress, being on the pill, the impaired digestion that I'd had for years and years, toxic overload, this picture had very much led into that diagnosis. And I know it was the same for you, Claire, with yours.
Yeah, absolutely. Exactly the same story. Mine was birth trauma and surgery with birth trauma that led to postnatal depression and waking up with that chronic fatigue. Just had a comment about glandular fever, and I was, yes, and actually the more that you go into learning about how the endocrine system works, I think glandular fever is very much is definitely the precursors to getting the glandular fever that causes as a trigger event that causes any of the fatigue disorders is definitely the same. It's the same story. It kind of doesn't matter what the trigger event was.
It's the Epstein-Barr virus.
Yeah, it is. Yeah, mono.
Glandular fever, absolutely. Yeah. So when we are working as practitioners in clinic and we have someone who comes in with one of these diagnoses on the right, and it can come from a trigger event, we've got to look at the history and start working back. Oh, this is a good one.
Oh, yeah, it is a good one. And the thing is, I remember...
Controversial. I find this one's a controversial one, but it is so important.
It is controversial. And I say this to anyone experiencing any illness, and I don't say this lightly, but every single illness, condition, experience is a gift. There is gold to mine. It's just sometimes in the middle of a dung heap, and it forces us to evaluate our lives. And I remember just literally praying that I'll just go back to normal. I just want to go back to normal. I just want to be myself again. I just want to be myself again. And I never ever became that person again. Never. And I look back now and I am unbelievably grateful that I am not that person. I wouldn't be doing this work. I wouldn't have the consciousness that I've got. I just wouldn't be living any single part of my life had it not been for this horrendous condition that has absolutely obliterated, gosh, what, 17 years of my life? I think I've been in remission for 2 years. So there is a huge part of grieving an old life. And I know a lot of clients who go through this, and that marriages might break up on the back of it because they can't function. There is just so much in it that is horrendous to have to grieve. So I don't say this with any kind of lightness. It is a hard process. But it's the same with cancer. I have so many clients who've gone through cancer, and even terminal cancer, and there is a point where they go, I see the gold in this. I see how it's changed me. I see how it's changed my relationship. I see how it's forced me to look at this. And so that is the beauty in these conditions, because I don't have a fear of getting unwell again. But I have learned to put boundaries in place that are so strong, because that's what my body needs of me. If I am going to function, I absolutely have to hold these boundaries in place. So I can't put my needs last. In fact, I have to put them absolutely first. And I've had to learn how to deal with that process. And this is the process that I go on with clients, is how do you learn to put yourself first and your needs, not what you think other people need, not the stories that you're telling yourself. How do we listen to our body? Because sometimes our body wants to exercise. Sometimes it's want to stay in bed all day. How do I create a world where that is possible? It's not always possible. So how do I then build some capacity for resilience? It's like, the irony is, it's this incredibly self-absorbed process. And I don't say that negatively, because it's actually a beautiful process, because we teach other people around us that they too can be, put their own needs first. So we start to create a different world. But it's incredibly self-absorbed from a predisposition of perfectionism, not fitting in, all of those things, when now the only thing is, I got to put the needs of my body first. Okay, I might seem like a weirdo with what I'm eating. Actually, I'm not going to feel rubbish tomorrow. So it's neither here nor there. And actually what happens is we end up, everybody I know who's in remission from a fatigue disorder, we end up living a life of such authenticity, and autoimmune, I'm going to say that for any of the conditions that we work with, we end up living such a life of authenticity, because we have to strip away all that we thought and work with what is actually real and present.
I think
that's the psychological aspect of this, I think
when we look at our client base, when we have clients who maybe have a bit of a twinge somewhere, then they are prepared to only maybe go so far with their diet changes and their supplements, and they don't particularly want to change their lives very much. I think people who have these chronic conditions, chronic fatigue disorders, or like an autoimmune condition, are much more willing, because it is so life affecting. They are so much more willing to be able to go that extra mile, to be able to reclaim a life that makes sense. And so it's very interesting working with this fatigue disorder clients, because and we will talk through the different processes that we work through, and we do have that it's quite a long process, and as you go through the process, it does get more extreme. The diet gets more focused, the supplements get more focused, the lifestyle gets more focused, but like you said, boundaries get more focused, everything gets more and so that can be really interesting to work with, and they're prepared to do that work and to get the rewards, that you can start to claw back a life that it has a lot more meaning, it makes a lot more sense. Actually, it's when you're able to see that the condition can be something that is helping you explore lessons in your life. But yeah, they will go further.
Yeah, and people don't believe it to begin with. Yeah, people don't believe it to begin with. Although, yeah, thank you for that comment, that you totally get that. It's fascinating to watch the journey, and it is usually one of the first things I say to people when they come in. There is hope. There is light at the end of the tunnel. There is a way to manage this, and there is no silver bullet, and this whole experience is actually giving you the opportunity to carve out a life which is serving you and your health.
And because it can be so limiting, that there are so many emotions involved in this, and as a coach, if we can help clients explore them, and because of the traditional approach to these chronic conditions is a bit of disbelief, sometimes it can really create a lot of anger. And actually, how do we as coaches help our clients explore that anger, explore this pain, explore this grief, be with what is, so that we're able to understand ourselves more and work through this?
Yeah. Okay, so the triangle of hormonal health was absolutely developed because of the issue predominantly around chronic fatigue, actually, because this came through my experience of going, why aren't I getting better? I'm doing everything right. I've been doing everything that I've been taught in nutrition. I've been doing everything that I've been taught as a kinesiologist. Why aren't I getting well? And starting to pull the strands of all of these bits of research that were starting to come to the surface, because like I said, this is all really new research. So the triangle of hormonal health was something that was devised by me in 2016, and then I told Laura about it, and Laura ended up down the research rabbit hole. And what we love so much now is that the rest of the world has caught up with us, and it's almost like on a weekly basis there is now, you know, something else talking about, you know, blood sugar hormones or something, and its connection with this, that, and the other. So we're super excited right now because this is absolutely coming to the fore. The triangle of hormonal health is basically this, it's an interplay between three sets of hormones, and a bit like a stool, we need these three sets of hormones to be kind of, you know, even legs on a stool. And the premise is that when one of those legs goes wonky, when there is an imbalance in one of those sets of hormones, we now have this, you know, issue. When there is, you know, one or more of these legs out of balance, what happens is we end up with symptoms. And the first symptoms that show themselves are actually in the digestive system and in the immune system. And so those three sets of hormones are the blood sugars, the stress hormones, and the sex hormones. So the fatigue disorders and things like IBS, etc., do happen to men. It's just a lot less common than it is with women.
And what we're going to do is we're going to look at all of these different sides of the triangle from the perspective of fatigue disorders.
Oh, understanding the role of blood sugars.
So those with a fatigue disorder have difficulty regulating their blood sugars.
Yes.
And it's a chicken and egg situation. Fatigue is also a symptom of blood glucose imbalance. And we're going to look at 4 different hormones. This was super interesting, this research. So we've got, let's start on the top left-hand corner, we've got insulin. And everybody seems to know that that's the blood sugar hormone that gets the most press. And it is about lowering our blood sugar. So if we are eating carbohydrates or sugars and sugar hits the bloodstream, then insulin is released to be able to lower our blood sugar. However, when we're on this roller coaster, I think this is the next slide, and our students know this inside and out, is that when we're having a predominantly carbohydrate-based diet, our blood sugars are going up and then they're crashing back down again, and then we're craving, and then we're eating something carbohydrate-based again and they're spiking up. And this blood sugar roller coaster, this release of insulin on a regular basis, actually contributes to fatigue and anxiety. We've also got leptin, which reduces our appetite, and this is fat burning. So this leptin is released when we've got food in the system, and increased leptin levels are associated with pain. So this is the connection in with fibromyalgia. It's also when leptin is imbalanced, it is also linked with poor sleep and infections. Super, super interesting. This is why we bang on about blood sugars. And when you see fatigue disorders coming into your clinic, then you can, the first place we look is blood sugars, because of this link that if the blood sugars are out, if there is an imbalance in leptin or insulin or ghrelin and cholecystokinin, then we are going to start to see these symptoms that are very common within the fatigue disorders.
Yeah, I also just want to say that leptin and ghrelin, also there's a lot of research that links them to imbalances in those hormones to anxiety. And as we know that people with fatigue disorders in their head, just being tired will lead to the anxiety of not being able to function, not being able to get through the day. And so by balancing the blood sugars effectively, we're actually dealing with half of that job already. So the difficulty, as Laura intimated, is that people with fatigue disorders have to work harder to balance their blood sugars. And this is not just a case of I've had a fasting glucose test and my blood sugars are fine, because where the medical model is blind, and this is a really big aha moment that I want you to take home, where the medical model is blind when it comes to a fasting blood glucose test, is it doesn't take into account, so your body's job is regulation, right? That's your body's job. Homeostasis, you might remember that word from GCSE biology. It's getting rid of too much carbon dioxide, it's getting rid of our toxins, it's bringing the body into balance. That is your body's job. Fasting glucose test, all it's saying is that your body has managed to do the job in that moment of bringing those blood sugars into balance. It's not saying how hard it's having to work to do it. And that's the key. It's not saying how hard your pancreas is having to work, how much insulin it's having to produce, how much leptin is like out of balance. It's not looking at any parameters of where you should be. It's just saying there's a metric which says that's okay for now. And this is the bit where blood sugar tests are actually leaving doctors completely blind when it comes to the fatigue disorders. I mean, actually, any of the things that we talk about, but this is the biggie. So if we have a fatigue disorder, and I say this as a we, because whilst in remission, it's because I have to work really, really hard at my blood sugars. And I notice as soon as I don't, I can just be wiped out for a couple of days. We have to work really hard. And it's not just a case of having a snack, you know, regularly. We're going to talk you through actually what really balancing your blood sugars looks like.
And so looking at cholecystokinin, this is a hormone that is primarily linked in with fat digestion and digestion. It's a big one in IBS, and it's got a connection with the vagus nerve, and the vagus nerve runs through from the brain down into the digestion. It is a big part of our parasympathetic nervous system that helps us feel calm. And so when cholecystokinin is out of balance, this has a knock-on stress response in the vagus nerve, which then contributes to anxiety. High anxiety leads to high fatigue, and anxiety is a big symptom within the fatigue disorders. And so cholecystokinin, with this digestive piece that we are looking at, that a lot of the time with fatigue disorders, there is a gut interplay, then we can see that the blood sugars are playing a role in the gut health as well. It's all linked. It's the beauty of the triangle. It is all linked. Moving on to stress. We have two sides of our nervous system. We have the parasympathetic and the sympathetic. The sympathetic is our get up and go. It is first thing in the morning. It is getting the kids ready for school. It's getting ourselves to work. It's sitting in traffic jams. It's going to work. It's doing. It's being at the gym. It's our nervous system. So our heart increases, it's the heartbeat, our pupils dilate, we get more airway into the lungs, we sweat more, we digest less in the sympathetic. This is all about our get up and go. We're not focused on digesting and going to the loo, we're doing. Many of us live in the sympathetic nervous system. And many of us have issues with our parasympathetic nervous system, which is where we relax. This is where we have our digestion. This is where the digestion is stimulated. This is where the uterus relaxes. This is also where we feel more sexy and where sex plays a role. It is also how we sleep. The parasympathetic nervous system has to come online for us to be able to sleep well. And there was a really interesting study showing that 23 chronic fatigue symptom patients had this significant decrease in function in the parasympathetic and significant increase in function in sympathetic. And this absolutely feeds into our work around the importance of looking at stress, because stress sits in the sympathetic. And what we as practitioners need to be looking at is how we can support the parasympathetic nervous system to come online, because then we can get people sleeping better, digesting better, having better sex, having better periods, having better energy. We have to have this balance between the two nervous systems to be healthy. And when we're constantly living in this sympathetic, I think this really plays into that A-type personality that you were talking about earlier, who just lives in that go, 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 and then the burnout happens.
Okay, so we talk about this a lot, but the endocrine system at a very basic, this is endocrine system 101. So we have the pineal gland, which is responsible for light and dark, the hypothalamus, which is our central nervous system. It receives the messages from our eyes, ears, nose, mouth. So it's like, oh yeah, there's a train coming towards me, or this thing is hot. The pituitary gland, which oversees the whole of the endocrine system and sends out the signals and the messages, tells the endocrine system what to do, basically. And so the messages that it will be receiving are things like, I'm hungry, I need a wee, it's the time of the month to start bleeding. So there'll be all these messages going back and forth. So that's, actually what our hormones are these chemical messages. The thyroid gland, which is responsible for metabolism and for heat and for cold. So again, that connection with that thermal sensitivity that we were talking about earlier. The thymus gland, which is to do with the immune system, and the pancreas, which actually has two jobs, one of which we've already talked about, the hormone one, which is insulin, which is about raising and lowering blood sugars. But the other job, actually supposed to do 95% of its work, is actually supposed to be digestive and breaking down fats predominantly, so we can actually get vitamin D out of them. So 95% of its job is supposed to be digestive, and only 5% of it is supposed to be hormonal. And actually we're seeing in most people it's definitely imbalance there. Then our adrenal glands, which sit on top of our kidneys and are responsible for producing cortisol, adrenaline and other hormones, and then the testes and the ovaries. And when we think about the endocrine system, we think about imbalances in the endocrine system, people being tired or exhausted or wired. So tired but wired, so that I'm kind of on the ceiling feeling. It's not just, energized and embracing the day. It's like, I'm wired and I'm talking really fast. And it's that is absolute sign of parasympathetic nervous system response. Sorry, sympathetic nervous system response. Sugar craving, absolutely classic. Any inflammation in the body is showing an underlying issue in the endocrine system. Digestive problems, we've talked about, and we go on to talk about more. Colds and bugs, like getting them repeatedly. 1 a year, great. 2 a year, sketching on thin ice. Any more than that, there is definitely an imbalance here. Sleeping difficulties, headaches, weight gain or weight loss issues, the hot or the cold, like I mentioned, low sex drive and irregular periods, or anything that's going on in your periods. There's too light there, amenorrhea, hormone issues, early menopause symptoms. All of those things are symptoms that there is an imbalance in the endocrine system. And basically, what is going on, if I think the next slide, if I'm right.
I was just going to say that this is absolutely fatigue disorders. These are the symptoms. This is why I see fatigue disorders absolutely sitting in the endocrine system. And what we were showing before with the sympathetic and the parasympathetic, that's kind of top of the chain. That's your hypothalamus.
Yeah.
And when that is off, when we're living in the sympathetic, then all of these other glands go down, causing the symptoms, which are absolutely what a fatigue disorder includes.
Yeah. So we talk about this a lot. This is called the HPA axis, or the axis is a communication, the conversation between the hypothalamus, the pituitary and the adrenals. And when we are under any stress whatsoever, then the hypothalamus and the pituitary send a message to the adrenal glands that says, make cortisol, make the stress hormone cortisol to get us out of this danger, to get us out of this stress. And the adrenals make the cortisol. You can see from the red line that they send this message back saying, okay, I've done it, switch off the memo. But what happens in something called HPA axis dysregulation is that feedback loop gets switched off. So now there's just a one-way message, make cortisol, make cortisol, make cortisol, make cortisol. And so we end up in this fight or flight response because the body is literally thinking it's having to run away from danger, but it's just an email coming in, or it's just, you know, that third cup of coffee of the day, or the kids are shouting. It's just because we're in a sympathetic nervous system response. Everything is a stressor at this stage.
This is a really interesting one. So this HPA axis dysregulation, there are thousands of scientific peer-reviewed studies on it, which is amazing. Actually, there are no scientific studies about adrenal fatigue, and it's a really interesting one that Claire and I are having a discussion about at the moment, because adrenal fatigue is not necessarily the case. When you start to measure the levels of cortisol in someone who's got a fatigue disorder, they can either have, you're meant to have cortisol high in the morning and it gets lower and lower and lower, and then you go to bed at night because your cortisol is low. In a fatigue disorder, you can have someone who's got really low cortisol in the morning, which means they're absolutely exhausted, and then it increases by the time they go to bed, so then they can't sleep. Or you can have it where it spikes, or you can have it low, or you can have it high. So I think the adrenals are fatigued as a category for the whole thing is a misnomer.
I think they're confused. I think the adrenals are confused. And like Laura said, you know, the WHO say that it's a nervous system disorder. It's definitely a parasympathetic nervous system disorder, but it's partly to do with this conversation. And there is still not a definitive, absolute, this is what it is. It is an adrenal confusion for sure, because there's been quite a lot of science that shows that people have low cortisol, but when you think about low cortisol, the body's stopping fighting anything. It don't want you to fight anything. So it's almost like in the low cortisol, we actually want to get we want inflammation, and the inflammation is when the body is trying to fight off a bacteria or a virus. So I think that one day we will see the most beautiful research that actually shows, probably a little bit like that blood sugar roller coaster picture we showed you, probably that someone with a fatigue disorder can go through things that look like this. It kind of goes all over the place. Sometimes, especially if they've got an EBV or something like long COVID, their cortisol might be really low because the body's going, I'm trying to fight an infection here. I'm trying to do this thing. I don't want you to run away. I want you to be in bed because I'm trying to fight an infection. And at other times it's really high. And I think we're going to actually see this confused adrenal profile. But at this stage, we do not have an absolute. So you will hear people talking about adrenal fatigue. I think that's true in some cases. You will hear people talking about high cortisol. I think that's true in some cases. And you'll hear people talking about nervous systems. And I think that's true in probably most of the cases. So it's a very interesting one. And cortisol dysfunction can be caused by inflammation from chronic stress, viral infections. So like we said, the viruses suppress cortisol to survive. High estrogen and low progesterone. So again, that comes into that whole hormone mix. And toxic overload such as mold or heavy metals, and this leptin resistance or sensitivity in the imbalanced blood sugars. So there is a picture, and there is something going on in the adrenals for sure. And there is something going on in the nervous system. And at this stage, no one quite knows because that research hasn't quite been done, but we're getting glimmers of it coming through.
What I love about what we're doing as coaches is that constant asking questions why. So when we assume that the body's not producing enough cortisol because it's a mistake, I love this with the immune system. It's not necessarily a mistake.
A mistake.
The body is a wonderful thing. Maybe the cortisol is low because the body is dealing with an infection. So when we can start to have those questions, then we can start to step back and really look at someone's profile and be able to really support them.
And by infection, it
coaches,
doesn't have to be something like EBV. We could be talking about parasites in the gut. We could be talking about
bacterial overgrowth.
Non-intestinal bacterial overgrowth, which is where the gut connection can come in. So we have to start thinking about this more broadly, I think. And also, I think it's very important to stay away from the absolutes of it's adrenal fatigue, it's this, it's that, or the other.
Absolutely. Bring on the sex hormones.
So this is where the adrenal glands are really relevant in fatigue disorders. So our adrenal glands don't just make our adrenaline and our cortisol. They also are partially responsible for making our sex hormones. So our sex hormones are made by testes, ovaries, but also the adrenal glands. And so in the case of menopause, as the ovaries switch off, the adrenal glands are supposed to take over making most of that. But the truth is they're making it throughout our whole life anyway, or are supposed to be. But what we're starting to see for a variety of reasons, because everyone's stressed in an HPA axis dysregulation mostly, is that we're not making our sex hormones properly in the adrenal glands. Now, it's quite interesting because before I go on to the middle pathway, the pathway to my right, the aldosterone. Aldosterone is a hormone made by the adrenal glands, and its job is blood pressure regulation and fluid retention. And so many people, so many women particularly, are on fluid retention tablets and high blood pressure medication. And then you start going, hang on a minute, there's something else going on here. So this clinic model is called the pregnenolone steal. I hate the name. I think it should be called the progesterone steal because it makes more sense. But basically, the adrenal glands take cholesterol, aka fat. And this is where it starts to become very interesting when you start thinking about when yuppie flu started to become a thing and the low fat diet started to come in. And of course, we're still very much in a perpetuated myth that fat is bad for humans. The adrenal glands make cholesterol from fat. Cholesterol is very important, and it's one of the ways it makes our steroid hormones. So the first one of which is pregnenolone. Pregnenolone does lots of things on its own, but its job is also to make other hormones. And it goes on to make progesterone, and it goes on to make DHEA, which then goes on to make testosterone and estrogen. However, when we are under stress, and let's just remember back to the HPA axis dysregulation, the pregnenolone will actually turn that progesterone. It will make cortisol instead, because whilst progesterone does a lot of things, it's calming, it's mood stabilization, it's actually hugely balancing out for estrogen, anti-inflammatory, all of these things. It is predominantly the progestation hormone. It's predominantly for thickening the womb lining. And so the body actually sort of says it's more important for us to get away from the saber-toothed tigers than it is to create the right womb lining. So it chooses to make cortisol instead, perpetuating the HPA axis dysregulation because we can't calm down. Without progesterone, we will not be able to get into parasympathetic nervous system. We will stay in sympathetic nervous system. So that's how this is part of the picture. So you can see that with this triangle, that when I've got too much stress and my blood sugars are out of balance, my sex hormones are going to go out of balance, which then perpetuates the whole cycle.
And when we're looking at hormones like testosterone and estrogen, that's the side where we're going to be getting our energy and our get up and go. And then on the other side, we've got the progesterone, which is our calming, sleep, digestion, it's being able to relax. When we see the importance of these hormones and how they work in our bodies, you can see the connection between fatigue disorders, because these are the symptoms that are playing out with fatigue disorders. So yes, that absolutely demonstrates what I was just saying, is that when there is a loss of estrogen, progesterone and testosterone, we are seeing symptoms like insomnia, we are seeing fatigue, we are seeing stress, we're seeing anxiety, we're seeing headaches, we're seeing loss of concentration. Yeah,
so we've put it here as the peri to post menopause, because this is actually what defines perimenopause is progesterone falling off a cliff and there being too much estrogen. But actually, someone who's in the pregnenolone steal, someone who's in all of that parasympathetic nervous system deficiency, that sympathetic response, we're seeing this much, much earlier. This, I truly believe, they're not in perimenopause, but they're in this progesterone falling off a cliff situation years and years and years before. So it might be that they've been on the pill, it suppressed their ability to make progesterone, they might have had really bad periods, they might have had fertility issues, but those precursors, you know what we said about someone coming in with a fatigue disorder, you look right back, there will have been something that actually suggests there was a progesterone drop off, that it's almost like it's mimicking this early perimenopause, which is unreal, actually. Unreal, which is why women are having worse menopause now, by the way.
And when we were talking about the trigger events, it's these dotted lines.
Yes.
It is when we hit, say, puberty, when we hit fertility, when we hit perimenopause, when we hit menopause, when we hit these big hormone stages, it is often that can be the trigger that leads to a diagnosis. Ah, the digestion. Oh, leaky gut. Okay, so we do love a processy diagram. So when we are looking at gut dysbiosis, and anybody who is interested in this, and students, if you're watching this, this is the SIBO talk. This comes from some of the SIBO talk that we did last time. Gut dysbiosis, where the gut is not functioning properly and there is a damaged gut lining. And there is gut permeability, or say a small intestinal bacterial overgrowth. And what happens is that this gut dysbiosis really stops people, your clients, from being able to absorb nutrients. Some of the biggies, particularly things like fat soluble vitamins like vitamin A, D, K, E, and all of these are so important for the immune system, but they're also so important for our endocrine system and important for our health. And what also happens when there is a gut dysbiosis and this gut lining is damaged, this is the leaky gut, is that lipopolysaccharides, which is endotoxins, enter the body and enter the bloodstream through the gut barrier. Now, this triggers the immune system to produce cytokines that spread inflammation in different parts of the body. The immune system is on high alert. If this is constantly happening, if that gut wall is damaged and these endotoxins are constantly going into the bloodstream, then the immune system is going to be going, right, we've got to fight this. This is going to cause an increased stress response. When we've got increased stress, we're in the sympathetic nervous system, which means we get no parasympathetic nervous system, or less activity, which means decreased digestion, which then increases things like food allergies and intolerance, which adds to more gut dysbiosis and gut permeability and more leaky gut. So this picture, when we have this damaged gut with these endotoxins coming into the bloodstream and this immune system on high alert and the stress on high alert, we are in this picture of a very stressed body that then leads on to something such as a fatigue disorder. And this is why it is so important to be working with the gut, to be able to heal that internal environment so that the stress can come down, that we can digest our foods better, that we can digest our nutrients better. With fatigue disorders, there can be a malnutrition piece. Even if they're putting good food in, if you're not absorbing, then you're not going to be getting those nutrients in, which contributes to fatigue. So we have got to be looking at the gut. There are thousands of studies that link a poor microbiome. So the microbiome is your gut environment with fatigue disorders. And there was a really interesting 2016 study where scientists were able to look at stool samples and identify 83% of patients with chronic fatigue from their stool samples alone. There is also, we're going to start coming into the post-viral a little bit more now because we're going to be going into the immune system. But there was a study in 2020 of 106 patients who 6 months on, they could see that the friendly bacteria and the unfriendly bacteria that regulate the immune function was really compromised in long COVID patients. So this is more backup that this link between the immune system with fatigue disorders and with the gut. With us as coaches, we have to be looking at healing the gut. We need to be looking at the food that people are eating, and we've got to be able to be creating healing so that people can be digesting, and also we're not getting this immune and stress response.
And I just want to say that I had been working on my gut for, I think, oh blimey, when did I get diagnosed with that? Like maybe 12 years, yeah, 100 years. And I had such cognitive dissonance that there was an issue in my gut. And it was only when I started going through my menopause and couldn't tolerate my hormones, and I was still going through my fatigue. Like, my big issue was the fatigue. It's always my first thing that I moaned about, not the menopause, my fatigue. Hot sweats were just a pain. This was the worst thing. And it was only then when I did a SIBO breath test and discovered that I had SIBO and treated the SIBO that then my pathway, after, I mean, literally over a decade of dealing with this. And so anybody who's watching this who has got a fatigue disorder, I would really recommend that you watch our video on SIBO and the gut, because the connection is astonishing, because you cannot begin to even go close to healing the fatigue disorder without healing the gut first. And I'd heard about leaky gut. I thought I was doing everything for leaky gut, wasn't even coming close.
Yeah, absolutely. The immune system. Okay, this became news around COVID, the cytokine storm. And cytokines are immune signaling cells in response to an infection that tell the immune system what to do its job, to start killing the infection. And a cytokine storm is a really interesting thing, because it's described as the immune system responding aggressively to the infection. But the way that we see it is that the immune system, if you've got something like leaky gut, which is on high alert already, you are putting on an additional infection on top of that. The immune system's working its hardest, I don't see the word aggressively. I see a very, very stressed immune system in a cytokine storm. And symptoms can include fever, nausea, fatigue, and body aches, which absolutely sits into this fatigue disorder category. And what was interesting is that there was a study that looked at fatigue disorder patients, compared them to healthy controls, and they saw that chronic fatigue patients had a flush of these cytokines, had a cytokine storm around the 3-year mark after they were having the infection. So they were still in it, which is incredibly stressful for the body. And they see that at this point the immune system shows evidence of exhaustion, and then after the 3 years then the cytokine levels dropped. But we have got to be, as coaches, questioning whether, if there is an infection that the body isn't able to deal with. Now, if we're looking at the history of the person, if they've got leaky gut, if they've got high stress, if they've got that whole picture, and you're sticking an infection on top of that, then absolutely you're going to have a stressed immune system. And we've got to look at that, the whole picture, as well as the infection, as well as the individual, to be able to get underneath what is happening.
Can I just say about that as well? It's very interesting. The people who have had a huge response to the trigger event, and I'm talking about the people who went from, you know, running marathons to literally cannot get off the sofa, can't be touched, and I have had clients who are, and no word of a lie, literally living in one room that's darkened. They are brought food, they can't move, and it is 3 to 5 years until they can actually start to begin to function again on some level. They're not well. They still very much experience their fatigue disorder, whichever one it is. But it is the 3 to 5 years where it's the, okay, I could at least put a light on or open the curtains. And so it's very fascinating that, so it's like the 3 years, and depending on how bad that cytokine storm has been, that it then starts to decrease over time, and then their body can actually start to respond. And like I say, that's usually when they're going, okay, now I need to do something, because I cannot have my life defined by this condition.
And this is why fatigue disorders very much sit in the immune system as well, because it is this It can be this cytokine storm that's happening that is contributing to the systemic inflammation that's happening in the body. But we have got to look at all of the reasons why there's inflammation in the body. It can't just be the infection, and it rarely is just the infection. Looking at viruses, the Epstein-Barr virus, which is the glandular fever, and the mono in America is the herpes virus that camps out in the B cells. It's quite a smart virus, and it's one of the reasons why it stays in our system. And it is estimated that 9 out of 10 adults have the Epstein-Barr virus, which is incredible, because once you get it, it's a bit like getting cold sores. It's in your system, and then it can trigger, and it can show symptoms, and then it goes back into being dormant. So it remains inside the body, active or dormant, until it's reactive. And there is a link between Epstein-Barr virus and chronic fatigue. There are many, many cases of people who reported having glandular fever and then having chronic fatigue or ME afterwards. The scientific literature is I found quite empty of making these links. It's much more of a, we see this in the ME and the fibromyalgia and the chronic fatigue communities who are sharing this information. So there is more research that needs to happen. But again, what we are wanting to hammer home is that it's, if there's 9 out of 10 adults who have this virus, then it can't just be the virus that is the issue here. It is the environment that the virus enters that we have to look at.
Yeah, and again, I have worked so much with people with Lyme's or EBV, and it's I've had a flare up, it's the EBV, I've had a flare, it must be this, and it's this battle against this virus, against this. And no, it's the environment. What else is going on? What's happening with diet? What's happening with stress? What's happening with everything that is allowing your body to let this flare up? And we don't, unless you have a blood test there and then that shows that it's active, we don't actually know that it is in that moment.
Post-vaccine syndrome. This is an interesting one. We are seeing fallout in our clinics from having different vaccine schedules. And one of the things that there's a very interesting study, very in-depth, interesting study by a wonderful guy called Chris Masterjohn in America. And he has raised the debate around the added ingredients that are in vaccines that are potentially causing problems with this post-vaccine syndrome. So people are having the vaccine and then experiencing side effects afterwards. So there is in the
and can I just be really clear, is that it's not just, we are talking about the COVID-19 vaccine here, but we have both had teenagers in our clinic who have just had the meningitis vaccines, or the sort of the 15-year-olds vaccines, and then literally are now unable to, attend school. Massive fallout. It's a very common time. Actually, must put that on our trigger events. It's a very common trigger for fatigue disorders.
And so why we want to talk about this is because it's an important picture of working with a client, is if they come in and say, I had a vaccine and now I've got this fatigue disorder that's happened afterwards, that I've been given a diagnosis afterwards. And it can be the PEG, polyethylene glycol, which is a chemical that is used in many different cleaning agents. And
it's one of the big 6 most toxic chemicals that's in loads of toiletries and stuff, but it's a preservative.
It's a preservative that is used in the COVID-19 vaccines. There is also aluminium in the COVID-19 vaccines, as well as there are a number of different vaccines, childhood vaccines as well, that have aluminium and formaldehyde. It's used in the processing. They say it's diluted out, but it is, they say trace elements can be found in the vaccine. There's antibiotics in the MMR. The other thing to consider, if you are working with someone who has had a COVID-19 vaccine and has symptoms afterwards, and particularly if they're female. The Pfizer vaccine was dosed at 30 micrograms, which is the upper limit for a grown man. It is not dosed for a woman. So we have seen a knock-on effect with women having side effects from post-vaccine syndrome. So it's important to understand this picture, because us as coaches, we can start to work with heavy metal detoxing, which we're going to come on to. And so getting that full picture of where someone is at can give you a better idea of how to work with them and what to recommend. Is chronic fatigue an autoimmune condition?
One of our age-old conversations.
It's a good question. It's a good question.
Honestly, it feels so much like it.
What we wanted to say here is there are a lot of similarities, namely the increased inflammation, and also autoimmune is predominantly a female condition. It's 75% of autoimmune sufferers are female. What is really interesting is that studies show that a suppression of immunity can result in fatigue relief in some. So this again is showing, is it this cytokine storm where the immune system is overactive? I'm always interested in autoimmune. The general picture is it's the immune system attacking the body. I really question that. I trust that the body is trying to do the best it can, and the immune system is working hard to do something. And yes, it is maybe one of the effects is that it is damaging its own cells, but I have a deep belief that it is trying to heal. The immune system is trying to heal. What's important as a coach is, what is it trying to heal? And that is what we look at here.
I agree. And oh God, I was going to say, and the other amazing thing is the way to manage the chronic fatigue disorders is exactly the same as autoimmune.
Yeah.
It's exactly the same.
Absolutely. There's been also some really interesting studies that show that in pregnancy, and you may get this is a good question to ask your clients, did pregnancy improve or make your symptoms worse? And there is reports and studies showing that women get relief from chronic fatigue syndrome when they're pregnant, and this is because of the high progesterone. So that calming effect, stimulating the parasympathetic nervous system, is the same in autoimmune. It's super, super interesting. And this is why we have got to look at chronic fatigue disorders from this lens of, is it hormonal? Is it immune system? Is it digestive? Maybe it's all of it. It's such a complicated picture. We've broken it down. We're going to talk next about the pathway that we take people on. It can get it's a very complete picture that we need to look at. With these,
really.
So let's go. The road to recovery. It's definitely a process. So what tends to happen is that trigger event where people fall off that cliff and are very, very, very unwell, and are hoping to find the miracle cure to get them back to where they were. And I liked what you said, Claire, is that you were never the woman that you were, but that's okay. It's the journey that it was meant to be. And this is important when you're a coach and you're working with people who are dealing with these kind of symptoms, is that it is not going to be a straightforward path. There is going to be bumps in the road. Those bumps are lessons and opportunities for us to learn about what's going on in the body. And it's important to set expectations of the journey that we are going to be going on.
Yeah.
It's not a straight line. And this is the complicated picture. We have to look at everything. We have to. When we've got a fatigue disorder, it's literally like we've got a tick list. First up.
I like to just like a lot of people, this looks really overwhelming, and I just want to talk about something that we haven't talked about for a long time, actually, called the spectrum of health. Because when I think back to the 27-year-old young woman that I was, that literally, went into that major cataclysmic event, and I think about the junk food that I ate, and the spraying myself with perfumes and all the stuff that I did, and the lifestyle that I'd lived, and I enjoyed the 90s. Like when I look at that life that I'd lived and the medication I was on prescription medication for migraines. When I look at this whole thing and the lack of positive mindset that I had, and just there's so much. If you'd have told me that I would be me in 20 years, I'd have laughed at you. And if someone had told me that I would be giving up gluten, I'd have laughed at them. If someone had said, you aren't going to be buying, you won't eat fish and chips, there was no way that any of that stuff was going to happen. But it just takes taking one step, just one step. You don't have to scale the mountain straight away. It's one step. One of my favorite phrases is, as a coach, it is our job to show people the issues in their diet and their lifestyles, and then hold their hands as they find the courage to take the steps that they need to take. It's not going to be in one day. It's not going to be overnight. It is going to be step by step, bit by bit, until they've claimed all of it. So it does look like a lot, but actually it is a step-by-step process.
So this, like you said, can be overwhelming, but I also think it's reassuring that when we're working with someone who is dealing with this, we can say to them on the first session, I got a lot of tools in my toolkit. There's a lot of stuff we can do here, but we are going to take it step by step by step, because often someone who is dealing with a fatigue disorder is in overwhelm anyway.
Yeah.
So saying, right, what we need to do is this. Right, we need to, and this is where the process and the step by step, which we're going to detail in a minute, is so important. So we need to be looking at food intolerance. I think that's top of the list, actually.
Yeah, it really is.
The first things I talk about, and if again, we've got a whole lesson on food intolerances. So if you haven't watched that, go watch that.
I kind of want to say as well, if you're in a place right now where you have got a fatigue disorder and you've already done a load of this and you're still not right, it can feel really, really unfair, because you're like, how much more have I got to give up? Like, what else is there? It's almost better. I sometimes think if I'd been my 27-year-old self and met me now as a therapist, and I'd gone, okay, well, we're just going to do this and done it step by step, I would have felt amazing within a few months. Amazing. But I'd already gone on quite a journey. So it's harder. The more we've given up and the more restricted that we feel it's going to be. But then the converse is also true. Like we said right at the beginning, the less you're able to live your life, the more prepared you are to keep going and keep going. And then the irony is, as I started to feel better, there are so many other things that have been able to come into my life, hobbies and like different types of exercise that I couldn't have dreamed of. So it does look very overwhelming for people, like we said, step by step. But what we're looking for is the payoff is you get your life back. And yeah, you might never be able to eat, a brioche again or a donut without feeling rubbish. Or you might be able to once, but probably not every day. And you probably wouldn't want to because you're going to feel rubbish. But you will be able to actually embrace your life again.
Mm-hmm. Yeah. I don't know if we need to go into, I think we're going to go into detail more. It says what it says. This is the list. Stages of treatment. We start off by removing the triggers. We've got to get the stress out. This is where we recommend, if they haven't had blood tests with the GP, to check thyroid functions, just see where their vitamin D is, see if they're absorbing vitamin D or if they've got any in their system, if they're low in B12. We just want to tick off all of those boxes. We want to make sure the processed food is out, junk food is gone. We want to make sure the food intolerance is out, and that's going to come in a minute. We need to look at toxic environment. So if there is, say, mold in the environment, if they are in a really stressful work environment, if they are in a really polluted environment, we need to have those conversations about how to change that. We need to take the stress out. That is lifestyle. So that is sleep hygiene. That is making sure that we are out in nature, that we're not working too hard. I mean, people with chronic disorders can't work that hard anyway. So
not doing HIIT classes ever with a fatigue disorder, not running, doing incredibly gentle workouts, and only when you actually feel the desire to do them, not because you're worried about putting on weight.
Yeah, absolutely. This is where we work with adaptogens. I've got some sexy slides coming up in a minute about adaptogens. We're looking at macronutrient balance, which we bang on about a lot. This is your PFC, protein, fats and carbs, making sure that when we've got our macronutrients in balance, then we've got our blood sugar stable. If we've got our blood sugar stable, then we've got our cortisol stable, then we've got our estrogen stable, then we're digesting better. So getting that macronutrient balance is so important and is one of the first stages. Getting those micronutrients in there. If they've got a poor digestion, then they might not be absorbing. So we want to be making sure that they are digesting properly, and as well as cutting out those food intolerances. The hormone balancing, the estrogen detoxing. When we get that hormone piece in place, and I'll come, the adaptogens is a big role in that, and the estrogen detoxing, which I'm going to talk about in a minute. When that's all in place, then we can start really working on the digestive system. Now, I would say people with fatigue disorders don't go in hard with digestive herbs. They will often have an incredibly compromised digestion. You've got to go soft, and you've got to go in with, well, removers first, which is food intolerances, and then replacing. Now you can look at things like some of the amino acids. L-glutamine is gut healing, but again, you want to go in really slow with supplements on the lowest levels that the POTS recommend. And with herbs, if you've got someone who is on the floor with a fatigue disorder, I would almost not be doing that first. The herbs and the cleansing and the which is the next stage, which is the immune function, which is the clearing out the heavy metals or clearing out, working with the virus. You need some resilience in the body. You need to build them up before you can start detoxing. There's a big mistake a lot of practitioners make, is that when they've got someone with a fatigue disorder, they're putting some of the hardcore stuff in to try and get them to detox harder, and it just sends them into more of a crash. We got to build them up. People who have got fatigue disorders are on the floor. So we go in softly with things like bone broth, for example, which is going to be incredibly gentle and healing, but is not going to throw them into some kind of healing crisis. The immune function comes a lot later. We've got to have the foundations in place before we can even start looking at clearing out heavy metals, dealing with mold, improving methylation, which we're going to come on to in a minute. So that's the pathway. If you take someone through all of that and you're still not getting underneath it, then lab tests and referring on to and we cover that in more depth in our courses of how to refer on. It's really good as a coach to know where you sit. What we're going to do is we're going to put the foundations in place. I'm going to take you through this process. And if I can't get underneath something, then I'm going to be able to refer you on. Right, detoxing. This is the immune system piece. So you've got your blood sugars balanced, you've got your food intolerances out, you're dealing with the stress, then sleep hygiene, lifestyle, you've got all of that in place and you've got a stronger body to work with. Then you want to be able to support the body to detox more. The body is always detoxing. This is the job of the liver. But we can do things to be able to support the body to detox more effectively. And this is important if you've got someone who has got post-viral, for example, had Epstein-Barr, or has been living in a mold environment, has had heavy metals, toxins in their environment, and you're wanting to get the body to be able to start clearing it out itself. We can look at you've got to get them out of the toxic environment. You're going to be supporting them with liver support, which is supplements, which I'm going to on the next slide. The other thing is moving the body and the lymphatic system. So hopefully you've got a body that is more able to move, but nothing stressful. Now, I think sweating is a really effective way of helping the body detox. So getting people into saunas and steam rooms on a regular basis, or getting them into a hot country to be able to sweat out an infection, a virus, a mold, is such a natural, gentle way of the body being able to clear itself.
The only thing to say is if they are deep in that thermal sensitivity, they will really, really struggle with being in a hot place. So just again, it could just be even 2 minutes, 3 minutes. And I know people who have literally been using saunas, building themselves up 5 minutes, you know, then eventually getting up to something like 10 minutes, because that's a sign that their body is learning to cope with that kind of experience.
Yeah, and I want to say this is not the first thing that you're going to be recommending. This is way down the line once you've got your blood sugars and your hormones and your stress and your digestion and the diet right, and you're wanting to take them further into enabling the body to be able to detox more effectively. Avoiding antiperspirants, please get them to quit on antiperspirants, throw their deodorants away. The diet pathway, I have to say that someone who has a fatigue disorder is probably going to be in the greens. But this is but this is the pathway that when you first start working with someone, you want to start with the food intolerances. You want to be making sure they're balancing their macronutrients. You want to be making sure that they're not using caffeine or alcohol. You want to be working with the hormone resetting. Fasting can be very effective, but if your blood sugars aren't balanced, fasting is not a good idea. And if there's a lot of weight loss, it's much more important with a fatigue condition that you are regularly making sure that that food is going in. Where I really see the fatigue disorders fitting within this diet pathway is the microbiome and the systemic reset. Those two diet plans, which you've got in your course, which are really stripping out the food, a lot of food intolerances. So we're cutting out the nightshades, we're cutting out dairy, no sugar, no grains.
Eventually nuts, seeds,
yeah,
seed oils.
Yeah, you're going pretty hard and fast with it, and you are really introducing healing foods. And so when you've got someone who's got a fatigue syndrome, yes, you're going to start them off on this pathway, but you are looking to get them into the greens here. You want them on a microbiome repair, or you want them on a systemic reset. If the microbiome repair isn't doing what it needs to do, and they've been on it for a couple of months, you're going to need to take it to the next stage.
Yeah.
And this is the food intolerance hierarchy that we work with. You know, wheat and milk.
Can I just say, going back to that other slide,
yeah,
they don't have to stay there. What you're then looking at doing is like, because I live in systemic reset, but it's not like I'm on a hard and fast diet anymore, because what you do is you start to put things back in and start to work out what things your body can tolerate now that you've done this reset. So it did get quite restrictive for a while, but the irony is, because I felt better, I didn't care. And then once I'd actually finally, and I could tell when my gut, when I finally stopped having a leaky gut, I could tell. And so then I actually had more gut resilience. And so now I can play around with it a bit more. So we aren't keeping people on a hard and fast diet forever. There is a place where it starts to come back in some semblance of what looks like a normal diet. It's just they're very aware of what will trigger them.
Yeah, absolutely. And I think that's a really good communication to have with your clients, is that we may need to go into this place for 3 to 6 months. But the view is that we're going to be able to repair the gut so that we can reintroduce more foods and so that you can have more of a diverse diet. But we've got to go to the streams to come back. So this is the food intolerance hierarchy. Cutting wheat and milk out of the diet is so important. People with fatigue conditions, you're going to want to go harder. You're going to want to be looking at grains, dairy, and nightshades as a minimum. Also eggs, if there is that gut dysbiosis, leaky gut picture, eggs can be a real allergen trigger food. And yeah, keep going further. I would be looking at beans and legumes and nuts and seeds, and also the allium. So that's your garlics and your onions and your what's what I'm missing? Garlic, onions, leeks. Leeks. So you are really stripping out a lot of food groups, but this may be a stage by stage approach, because if you have them on the first session and you're saying, right, I'm going to take out all of these foods, it can be too much of a shock. And
Yeah. And actually what we look as we go through that food, that especially the diet gateway, so putting more of other things in. So we increase protein, we increase fats. Delicious. No one's ever going to complain about that. So it's not like they're just getting smaller and smaller and tinier and teeny amounts of food. We're actually going, okay, we need to ensure that we're getting all the right amount of nutrients, but we're going to get it from over here and we're going to get it from over here. So it does balance itself out.
And if you want to know why we have this food intolerance hierarchy, check out our food intolerance lecture, which we go to detail. And you want to be putting nutrient dense food in. Bone broth, liver, which a lot of people don't like eating, but there are ways that you can turn them into burgers. Organic meats.
It's true.
Low toxic cooked vegetables, if you've got that compromised gut microbiome, the raw vegetables kind of have to go for the time being until you can repair the gut. So cooked, stewed, steamed vegetables that are low toxic, and seasonal fruits. This is very much what you're looking at as a very healing diet plan to be able to heal that gut and heal the immune system, and then you can take those steps back to reintroduce other foods. But you've got to get the nutrition in there. Supplements that we look at for fatigue disorders. Digestive support such as enzymes, if there is that digestive piece, and pretty much 9 times out of 10 there is that digestive piece that you've got to work with. Making sure that the vitamins A, C, D and E are going in. You can make sure that they're going in with food, or you can look at an additional supplement. But if they are not absorbing their foods, that could be an empty supplement that's going in and then they're just pooping it straight back out again. So you've got to make sure that the digestion is doing its thing before you're replacing those nutrients. Glutathione and NAC is a glutathione precursor, is one of those liver supports. And NAC, I would be working with NAC first, and then if that doesn't work, then glutathione. And they are supporting the liver to detox better. And there's some amazing studies that are showing how supportive it is when it comes to things like heavy metals, toxic environments, post-viral.
Estrogens.
Yeah. Also, when you're looking at a gut, if you've got a gut infection like SIBO, so NAC can be a really, really great one. Again, I would be introducing it slightly later on, maybe on the 3rd appointment or 4th appointment, once you've done that dietary work and you've got them eating better, so that their body is able to process and do what it's got to do with the supplement. You want to be putting maybe a vitamin B in. If you have clients who struggle to absorb their Bs, then you can look at something called a methyl complex, which is, I think, by NutriAdvance, which is one of the supplement companies that we work with, which just is an easier to absorb vitamin B complex. CoQ10 is an interesting one. Every time you look at any research to do with fatigue syndromes or post-viral, CoQ10 is the superstar, and it's to do with energy production, the mitochondria. It's not a big one on your list actually, but it comes up with the study.
It does, and it does come up with a lot with clients, and some people take it and they say it's like they feel like they've suddenly had a boost, like it's one of the ones that people have a wow from, if they're gonna have a wow. But I wonder if it's from where your trigger came from. So I'm curious around why CoQ10 works for some people and not for others.
You want to be making sure the minerals are going in. Zinc and magnesium are always one of our top ones. If you've got a client who is got heavy periods, for example, iron can be really, really important. B vitamins twice, clearly important. Omega-3, but make sure that they're digesting their fats. Now, one of the questions you can ask to check if they're digesting their fats is to check their stools, and if they've got floaty fats on the surface after they've been for a poo, then they're not digesting their fats, and that can be a sign of a gut infection such as SIBO, which is super interesting for us as coaches. So that means that we know what we're dealing with if they're not digesting their fats. You want to get
and also one of the other signs is if it's a normal omega-3, not a vegan omega-3, and they burp fish. If they burp fish, they are not absorbing that in any way, shape or form.
Yeah, so you want to get them digesting, healing the gut, digesting properly, and then the omega-3 can be a really important supplement to be able to help with the repair. Adaptogens are lifesavers and are amazing for these conditions. So I'm going to go into a little bit more detail, pull some science out. This I loved. I thought this was super cool. This is when we go into a super stress, the red line is our stress response. This is what adaptogens are doing. They are reducing the stress response. They are making the resistance phase more sustainable, and
they're essentially,
go on.
They're essentially, if you think back to the HPA axis dysregulation, that memo that gets switched off, they're essentially helping to switch it back on.
Yeah. And that exhaustion phase that happens after a stress response is less. So when you are working with a fatigue disorder, have adaptogens as one of your, I'm definitely going to be looking at this as one of my things in my toolkit. Adaptogen support, there is amazing evidence out there about particularly with post-viral recovery, which is super exciting. And you can see in this table that it has a direct antiviral effect, it has an anti-inflammatory activity, it supports the immune response, and it helps detoxify after the cells have been damaged. So lots of long science that goes with that. The adaptogens that were covered in the clinical trials are andrographis, Siberian ginseng, Panax ginseng, rhodiola, schizandra, ashwagandha, and licorice, which are all in your toolkits as practitioners, and would absolutely be the ones that you would be looking at. Now, Siberian ginseng, I would be looking at if you've got a very sex hormone picture. Panax ginseng is amazing for that fatigue picture. It can be like a get up and go, really gives energy. Rhodiola is amazing with the stress response that we've just shown.
Yeah, but that real not coping, very, very, very stressed.
Schizandra can be from that anxious
nervous system.
Very, very good for the nervous system. Ashwagandha can help you sleep. Licorice for the blood sugar support is also a get up and go. So absolutely be thinking about your adaptogens, and you've got your adaptogen questionnaire that you can use where you can put your clients the issue that they're dealing with the most, and it will give you the recommendation for the adaptogen that you need to be recommending to support you with your advice.
And it's I just want to say something about adaptogens. Adaptogens can change, particularly as you are going through the healing process with fatigue disorders. We do get to a point where we don't want people on loads and loads of supplements for life. I mean, I just can't even believe how few I'm on now. However, adaptogens, it kind of doesn't matter how far I get into my healing. I don't function as well without them. It's like a week, and then I go, why am I so tired? And I go, oh, it's the adaptogens. I've stopped the adaptogens. I just think if there's been a particularly a long history. I mean, mine was, my daughter's 19 now, coming up 19. Mine was a long journey, plus all the the precursors we were talking about. I kind of think that might be something that people are on for a very, very long time. And if not, I call it the scaffolding that's just around their house. It might just be life is stressful. Their bodies are never really going to adapt well to stress because of what they've been through. If that's what they're going to need, I do think we can get to a place where we have got past needing digestive enzymes, because you can get all that fired up with, the right diet and getting the immune system, everything, the sympathetic nervous system response down. There's quite a lot that we can work through. It does take time, but I do think, and that might be my limiting belief, but I do think that adaptogens for people with a very big history of a fatigue disorder are an absolute game changer.
There was an amazing clinical trial that showed adaptogens really supporting those with long COVID. That's rhodiola, schizandra, and ashwagandha. So those are the ones for the post-viral that we'd be recommending. is, what a biggie. It's a really, really big subject, and it's got so many layers, but we've got so much to offer for those with fatigue disorders.
Thank you for staying with us. We will stop the recording and open the room up to any questions. There's a few things in the chat, and thank you everyone who shared your journeys. Thank you, Charlotte and Susan, Antonietta, Michelle, thank you.